In the following video, we will talk about the sensory screening for stereognosis and the cerebellar screening for intention tremors. By the end of this presentation, you will be able to define stereognosis and intention tremors, demonstrate the screening process of the two impairments, and summarize each procedure. Stereognosis can be defined as the ability to recognize shapes, objects, and textures by touch, with vision occluded. It allows individuals to recognize objects without the use of vision. The screening procedure for stereognosis is as follows. Occlude the patient's vision. Select 6 familiar objects such as a fork, screw, coin, key, pen, and a toothbrush. Place one object at a time in the patient's involved hand. Begin with the uninvolved extremity. Allow the patient to manipulate the object for 5 to 10 seconds. Ask the patient to name the manipulated object. Repeat with the involved extremity. Alternate the sequence of presented objects for each hand. Stereognosis is indicated if the patient is unable to identify 3 or more objects. The following video demonstrates the screening process for stereognosis. Today, Taylor will be demonstrating the screening process for stereognosis. Her impaired hand is going to be the right hand. Okay, so Taylor, if you will close your eyes for me and place your hand out. We're starting with the left hand, the uninvolved hand, and manipulate only with your thumb and fingers. A coin. Good. A card. Good. A ring. Very good. A fork. And a key. Good. And one more. A pen. Very good. Okay, now we'll repeat with the right hand. A ring. Very good. I can't tell. Okay. Here's another one. Pen. Very good. I don't know. Okay. A card. Very good. And one more. I can't tell. Okay, thank you. Causes for stereognosis is disease of the sensory cortex or posterior columns, Alzheimer's disease, damage to posterior association areas of the parietal, temporal, or occipital lobes, and damage to the postcentral gyrus. Intention tremors, also known as cerebellar tremors, occur during voluntary movement of a limb and tend to increase as the limb nears its intended goal. A tremor is the rhythmic oscillation of joints caused by alternating contractions of opposing muscle groups. Intention tremors tend to diminish or stop when the patient's limbs are at rest. The screening procedure for intention tremors is as follows. Place the patient in a seated position. Give the patient a spoon and a bowl of water. Ask the patient to bring a spoonful of water to his or her mouth. An impairment is indicated if his or her upper extremity shakes as he or she brings the spoon to their mouth. The screening can also be used by performing finger to nose, finger to finger, finger to therapist finger, and alternating between patient's nose and therapist's finger. The following video demonstrates the screening process for intention tremors using an unaffected individual.
The purpose of this video is to show the screening process with someone who does not have intention tremors. For the first procedure, we are going to have the patient seated and bring a spoonful of water to their mouth. Good. Impairment would be indicated if the patient's upper extremity shakes as he or she brings the spoon to their mouth. Another screening process a therapist could do is have the client seated and have their arms abducted 90 degrees and instruct the patient to touch his or her nose alternatively with the left and right index fingers. The patient performs the task first with eyes open, then with eyes closed. Impairment is indicated if the patient exhibits increased intention tremors as he or she attempts to touch his or her nose with each index finger. Impairment also is indicated if the patient's accuracy of movement becomes worse with eyes closed.
The following video was kindly sent in by Hannah's grandfather. In this video, you will be able to see his hands shaking while he's eating. As you will see, he is using his other hand to somewhat steady his shaking hand to get the food into his mouth. Intention tremors are caused by lesions or damage to the cerebellum resulting from strokes, tumors, multiple sclerosis, and other inherited degenerative disorders. In addition, it can also be caused by chronic alcoholism and overuse of some medicines. By now, you should be able to understand and perform the screening for the discussed impairments and be able to identify atypical symptoms. Here are our references. Thank you for watching our video. We hope that you now have a better understanding for the screenings of stereognosis and intention tremors. We also hope that this video will be helpful in the future in your career. Thank you.